So far in our exploration of the skeletal system, we've looked at the physiology of bone. We've looked at the skeletal system, each of the bones and their features. Now let's look at how those bones interact with each other through the joints. We'll begin this lecture by looking at the various types of joints: bony joints, fibrous joints, cartilaginous joints, and then synovial joints. I'll cover the first three in detail and then introduce the general anatomy of the synovial joints. And then you'll go on your own to feature a particular synovial joint. So a joint that interests you, a joint that you've had injury to or family members had injury to that you'd like to learn a little bit more about. You'll feature how the joint works, all of its components, and then highlight a particular injury to that joint, what goes wrong in the joint, and how it's fixed. So, joints are articulations. It's any 2 points where bones meet, whether or not the bones are movable at that interface. For example, the sutures in the skull are joints, but they don't move. The study of joint structure and function, as well as its dysfunction, is called arthrology. And the study of musculoskeletal movement is kinesiology, which is a branch of biomechanics. It deals with a broad variety of movements and mechanical processes in the body, including the physics of blood circulation, respiration, and hearing. Joint names are typically derived from the names of the bones involved in that joint. For example, we've already explored the atlanto-occipital joint, the joint between the atlas, cervical vertebrae number 1, and the occipital condyles of the skull. The glenohumeral joint is the shoulder joint. It involves the glenoid fossa and the humerus. And then the radio-ulnar joint is where the radius and ulnar interact. So their naming is pretty straightforward at this point. Joints are classified according to the manner in which the adjacent bones are bound to each other, and by the differences in how freely the bones can move. So there are 4 major joint categories: bony joints, fibrous joints, cartilaginous joints, and synovial joints. Let's begin by looking at bony joints. Bony joints are named synostoses, syn meaning together, bones together, synostoses. They're immovable joints. They're formed when a gap between 2 bones ossifies and they become in effect a single bone. We've seen that in our examination of the skull. Both the frontal and mandibular bones in infants are separate bones, and then they become joined almost as if they were never separate bones at all. We don't even see a suture there. The cranial sutures, however, are a different type of joint, but in the elderly, they become just as fused as the 2 frontal bones in infants. We also see the first rib and the sternum become very tightly joined to each other in old age. So a bony joint or a synostosis is absolutely immovable. Another great example is the epiphyses and diaphyses of our long bones. In childhood, they're cartilaginous joints, and in adolescence, they become synostoses. So the joint may begin as a fibrous joint or a cartilaginous joint. However, later in life, those bones may fuse together to become synostoses or bony joints. Next, we look at fibrous joints or synarthroses. Syn meaning together, arthrosis meaning joint. So a joint, as in there's movement, but they're very close together, as opposed to synostosis, which was together as a bone, not movable. So fibrous joints are joined tightly by collagen fibers that emerge from one bone and cross the space between them to penetrate into another. There are 3 kinds of fibrous joints: sutures, gomphoses, and syndesmoses. We'll begin by looking at sutures. You can see this collagenous fibrous connective tissue goes from one side of the joint to the other. These joints are very slightly movable or immovable, and they closely bind the bones of the skull to each other. There are three different types of sutures. There's serrate, lap, and plane. We can see all three here, and they're parallel to different wood joints. For example, the serrate suture that we see in the coronal, sagittal, and lambdoid sutures have these interlocking pieces like a dovetail joint. The lap suture that we see between the temporal and parietal bones in the squamous suture is like a miter joint. It overlaps at an angle. And then the plane suture we can see between the palatine processes of the maxilla. It's like a butt joint in woodworking, where the edges of the bone just butt right up against one another. The next type of fibrous joint is a gomphosis. The only place we see a gomphosis is in the tooth attachment into its socket. You can see the fibrous connective tissue here, going from the jawbone to the tooth. These ligaments are called the periodontal ligaments. They allow the tooth to move a little bit under the stress of chewing, but not much at all. In periodontal disease, we'll see bacteria and infection that's moved below the gum line and affected the periodontal ligaments, such that their integrity is lost and the tooth may fall out. The third type of fibrous joint is a syndesmosis. Syn, again meaning together. Desmos means band. And osis, again, is a condition. So the condition of being banded together. This is a fibrous joint in which two bones are bound together by collagenous fibers that are much longer than we find in a suture or gomphosis, which gives the bones more mobility. So the syndesmosis is the most movable of the fibrous joints. We'll see those in the interosseous membranes. Between, for example, the radius and ulnar, there's an interosseous membrane that keeps them connected to each other, but allows the action of supination or pronation, that is, rotation in the wrist. Less movable one is in the tibia and fibula. There's an interosseous membrane between those two bones that's very similar to what we see in the radius and ulnar. It too allows pronation and supination of the foot. You can see here that the fibers are much longer. So before we move on, pull out a piece of paper and note down all the different types of joints we've looked at so far. We've looked at our synostoses, or bony joints, and we've looked at fibrous joints, or synarthroses. There were three types of synarthroses, and only one type of synostoses. So note those down quickly and the differences between them. I think paying attention to the Latin and Greek roots in these words is really helpful to understanding what the joints do. Now let's move on to cartilaginous joints. Cartilaginous joints are called amphiarthroses or amphiarthrodial joints. This is where two bones are linked by cartilage. Amphi means on all sides. Again, arthro means joints and osis means the condition. So amphiarthroses come in two forms. There's synchondroses and symphyses. Synchondroses means together with cartilage. Symphysis means together by growth. Physis is growth. So in looking at synchondroses, we see that bones are bound together by hyaline cartilage. We see this in the epiphyseal plate. It's a temporary joint. By adulthood, the epiphyseal plates are fused to become the epiphyseal line. We also see the first rib attachment to the sternum. Here is a synchondrosis. The other costal cartilages are joined to the sternum actually by synovial joints. And they're synovial because there's a joint capsule. We'll look at that in detail later. A symphysis is where two bones are joined by a fibrocartilage. The example of this is the bodies of the vertebrae and the intervertebral discs. and then the pubic symphysis in the front of the pelvic bones. The pubic symphysis is joined by the interpubic disc, and the bodies of the vertebrae are joined by the intervertebral discs. These discs only allow a slight amount of movement between the adjacent vertebrae, as the interpubic disc only allows a little bit of a movement in the hip joint. In fact, as a woman comes towards term in delivering a baby, this joint will loosen even more to allow more movement in the pelvis and passage of the fetus. So now we've covered all three types of joints: our bony joints, or synostoses, our fibrous joints, or synarthroses, and our cartilaginous joints. Make sure you have an outline of these different types of joints before we go on. We'll see you soon for the next section, where we'll look at the general anatomy of synovial joints.